For 20 years, Lily Foster's drug addiction dominated her life.
My issues with addiction started when I left a toxic home environment. I was 15 years old and I started using drugs as a way of dealing with my trauma.
She used a range of drugs, including heroin and methamphetamine.
3 years ago, I decided basically that I wasn't ready to die and that I was sick and tired of addiction holding dominion in my life.
Lily found help via a residential recovery centre and now uses her experience to support others. But she knows there are gaps in the system.
Drug use is still framed from the criminal perspective. It's treated as a crime, and it really isn't. It needs to be treated as a health issue.
The experiences of people like Lily are vital in improving drug and alcohol policy, but in Tasmania, their voices are missing because it's the only state or territory that doesn't have an independent organisation for people who have overcome drug and alcohol abuse.
Drug use in Tasmania is very diverse, and there's a whole range of different people who use drugs or may need support or education. So an organisation like this would represent that diversity.
Karma is a Canberra organisation that gives a lived experience voice to policy making. So far, it's helped create cannabis law reform, pill testing, and advocates for safe injecting rooms.
One of the things that Karma's been able to do is to change that kind of conversation that we have around drugs and to kind of push this idea of supporting people and not punishing them.
In the last budget, the Tasmanian government allocated money to existing organisations for lived experience work. Advocates hope it's the start of more significant change. Adam Holmes, ABC News.